our support for those courageous caregivers who ask that their voices may be heard for improved patient care, for safer staffing levels, for dignified wages and affordable health care.
At night, there's only 2 CNAs, 69 patients. There's no way, and throughout the whole night, that those 2 CNAs are going to get through all 69 patients. How do we know that there's not patients sleeping all 8 hours in the same diaper?
For California's 1,100 nursing homes, frontline caregivers provide the one-on-one care at the bedside.
We know many of the caretakers, the caregivers. We have spoken with them. We've spent time with them over the last few years. And when they suffer, then patient care suffers.
Our frail and elderly patients depend on them 24 hours a day, 7 days a week.
You cannot give all the care they want for 9 patients and 1 CNA.
But when staffing is too low, it's the patients who suffer.
You cannot answer their light on time because you're in the bathroom with another patient.
Steve Davidson was a patient at Windsor's Concord Nursing Home facility for 8 months.
There were times where I had to wait upwards of 2.5 hours to get somebody just to turn me. The bed sores that I had when I entered the hospital, I was septic, and you can actually die from the bed sores worsening to that point.
It's really bad. You know, it's right for the patients to complain about not, you know, getting their lights answered right away.
Regularly, I heard from different EMTs that their name for Windsor Manor was Death Manor. That's how they characterized it to me. Oh, you're going back to Death Manor.
I think it's on all the facilities that we're having staff problem. We have from 8 to 9 patients per CNA.
I was there for about 8 months, and these other patients are living there for years, enduring the same thing on a daily basis. Being so helpless as most of the patients are, I feel bad for them. I would not recommend my worst enemy to go to Windsor. It's that bad.
Windsor nursing homes have a disturbing record on quality of care. Last year, the State Department of Public Health recorded more than 500 violations of basic care standards at Windsor facilities. Spread across Windsor's 28 nursing homes, this is almost twice the national average.
A facility, it used to be 72 people, now it's 78, because Windsor is trying to squeeze a patient in any space available.
We had a shared 8 hours in between 8 or 9 residents.
The problems, you know, if they can't wait for you, they will try to do it themselves, try to get up, and that's, you know, falling results.
Caregivers at 8 Windsor nursing homes have been trying to address these problems through their contract negotiations.
We have already suggested that we want to be part of a committee to improve the standard of care for the residents that what we have right now at Windsor Country Tribe, but they definitely refused. Every time we bargain, they just drag it, they don't say anything, nothing's coming up, and we want to be able to give our input because we're the ones who know these residents most. We take care of them day in and day out, and they're the one deciding, and they don't know these people.
More edges. Do you remember what the flat part? Remember the straight part?
Many employees cannot afford the health insurance that Windsor offers, and with such low wages, they must rely on public assistance such as Healthy Families or subsidized housing in order to get by.
You're doing good. Right now, my son is receiving Medi-Cal through the state.
My dream is one day that I can be able to afford my own housing, not to be on public assistance, and to be able to get the health insurance from my job to my kids and myself.
I'm working. I shouldn't have to depend on the government. I shouldn't have to depend on these programs. It's embarrassing. I don't like it. You know, I think my kid's eligible for free lunch at school, and I mean, that's embarrassing too. I'm going to school to better myself, and I'm working at the same time, and I want to be able to support him without having to depend on the government to help me. Look at that, you're halfway done.
I work 2 jobs because it's not enough in one job. For 24 years, I'm making $15.73 an hour.
We have to give people a reason to follow their passions and to provide patient care. And one of the reasons is that they're going to make a decent living. No one's going to get rich off of these jobs working on the front line. But at the very least, we should provide living wage and competitive benefits to keep people in this profession and to make sure that our patients receive the best care they can.
It's really hard. Very, very hard, really. Because, you know, you are so exhausted already. You've got no more strength to work to the other patient. But, you know, trying hard. It's really trying hard to do it.
Many of Windsor's employees rely on Healthy Families, Healthy Start, Medi-Cal, live in subsidized housing, Section 8 housing. They're basically relying on the state. So the state, we're not only increasing our reimbursement rates for Medi-Cal, but we're also subsidizing the care of the workers for Windsor.
Last year, Windsor received $140 million in Medi-Cal revenue from the state, funding specifically intended to improve resident care in California nursing homes. Yet, at the same time, Windsor executives have been transferring money from their nursing homes to a handful of other businesses which they operate. Last year, they diverted $30 million in management fees and property expenses to their own companies. This was on top of over $5 million in profit.
And it seems to me that if a company is to receive state funds, then at the very least, they should be trying to lift the standard of living for its workers, not bring it down. And that's exactly what's in Windsor and throughout the healthcare industry. And that's something that, quite frankly, is unacceptable to me, and I'm sure to other legislators here in Sacramento, as a totally inappropriate use of state funds, a totally inappropriate use of taxpayer funds throughout the state of California.
There is a quid pro quo in terms of the relationship between the worker and those who need their care.
They're like family to us. We love them. They become to be family as soon as they come to our place.
We are giving a well care to the residents, and we are after the care of the residents.
I don't know why these companies, every single year we have to fight with them for a raise. It's disgusting. They get richer and we get poor, that's all it is.
So we have deep concerns about this culture, about this society, on the greater magnitude, as I've mentioned, as to how this country does business. It filters down to us in each of our communities. It is a blessing for us to be able to stand up for justice, and we hope that the owners of Windsor will be responsive to our message in terms of the transparency that they feel that they can give. We need to talk to them, to you, the owners of Windsor.
Lean on me when you're not strong.